So I welcome to the stage Dr. Ana from Portugal, who is going to talk about the study that she did in France.
Yes, good morning. I'm from Lisbon and I spent some time with Dr. Christine in Marseille and some time with Jean and others in Montpellier, and I'm talking about Dr. Christine's series. So we know that spondylolumbar and spondylolumbar listhesis and adjacent segment disease are traditionally managed with decompression and fusion, but the necessity of routine fusion in low grade it remains controversial. So with UBE, we can do a wide decompression, preserving the structures. So we decided to evaluate the rate of secondary fusion after decompression only with UBE and to evaluate other clinical outcomes too. Our group has two kind of patients, the spondylo patients and the adjacent segment disease, including overlap cases, like this one. Our study was a retrospective study in two hospitals, but in one center, 110 patients, 76 spondylo and 34 adjacent segment disease with 9 overlap patients. Our primary endpoint was the fusion, necessity of fusion after the decompression, and the secondary endpoints were clinical outcomes, including recurrences and additional procedures like thermocoagulation. Our mean age was 73 years old, female predominance, and the mean time follow-up was 8 months, but with a big variability in the range, with the biggest one with 34 months of follow-up. Our spondylo patients were a little bit older. All underwent decompression-only UBE, as we told. 6 patients had 2-level surgery. It was in the beginning of UBE technique by Dr. Christini. Almost everyone did preoperative infiltration, and 5 needed thermocoagulation or infiltration after the first decompression. Some had anticoagulation or anti-aggregation, but no major complications were seen. There were mostly grade 1 listhesis and 25 patients with only adjacent segment disease with no listhesis, and 2 patients were lost to follow-up. So in this series, no one needed fusion, and everyone, or almost everyone, got better, at least in a global perspective. The spondylo patients were a little bit better than the adjacent segment disease, as we expect. We have 27 patients that have paired ODI, pre-op and post-op, and in these patients, the outcome was very good. Everyone got better, and the minimal difference was achieved in 70% of these patients. In one patient, was needed another UBE after 8 months. Upper image is the first pre-op, and the second image is the second pre-op. This patient didn't need any fusion and is with 22 months of follow-up after the second surgery. So what we found was that no patient in this cohort needed fusion, with good improvement rates, acceptable functional improvement with the ODI that we had available, and a very low need of other procedures like thermocoagulation or articular infiltration. Our limitations is a retrospective design. We have a short follow-up duration now, and we have a complete ODI pair data, and is a single center experience. So decompression only was not associated with postoperative instability requiring fusion, and it may be safe and effective in patients with low-grade spondylo or adjacent segment disease, and even when they need to redo the UBE, is a good technique to solve our cases. But I think the biggest thing is to learn new techniques and discover a new big family. Thank you.